The origin of sartorius is from the anterior superior iliac spine. The fibers run inferiorly and medially to cross the knee joint and insert onto the medial surface of the proximal tibia. Sartorius flexes the hip and knee joints and laterally rotates the hip joint. It is innervated by the femoral nerve. The origins of tensor fasciae latae are from the anterior surface of the iliac crest and the anterior superior iliac spine. The fibers run inferiorly and insert onto the anterior surface of the lateral condyle of the tibia via the iliotibial tract. The tensor fasciae latae is a tensor muscle acting on the deep fascia or the fascia lata of the thigh. It maintains tension in the iliotibial tract to stabilize both the hip and knee joints. It is innervated by the superior gluteal nerve. Iliopsoas is one of a group of 9 flexor muscles that cross the hip joint. It consists of 3 separate muscles: the psoas minor, the psoas major, and the iliacus. Psoas minor is quite small, often absent, and is thus considered an unimportant member of the group. The origins of psoas major are from the vertebral bodies, transverse processes, and intervertebral discs of T12 through L5. The fibers run inferiorly and pass behind the inguinal ligament. They then wrap around the femoral head to insert onto the lesser trochanter. The origins of iliacus are from the superior 2/3 of the iliac fossa, the internal border of the iliac crest, and the ala of the sacrum. The fibers converge to insert onto the lesser trochanter with the psoas major tendon. The shared tendon is known as the iliopsoas tendon. With the origin fixed, the iliopsoas flexes the femur onto the trunk. With the insertion fixed and acting bilaterally, it flexes the trunk onto the femur. Psoas major is innervated directly by the lumbar plexus, while the iliacus is innervated by the muscular branch of the femoral nerve. The origins of pectineus are from the pectineal line of the pubic bone and the adjacent surfaces on the superior ramus. The fibers run inferiorly and wrap around to the posterior femur and insert onto the pectineal line. The pectineus flexes the thigh at the hip and adducts the hip. It is innervated by the femoral and sometimes the obturator nerve.